Test 1, 2. I'm Doug Smith, and I'm a practicing psychiatric physician. And today I want to talk with you about a new way of understanding physical pain. This will be the first in a series of videos on this topic, and I hope you'll find them helpful. For over 20 years, those who have been educating patients and clinicians, establishing priorities for research into pain, and advising healthcare regulators and policymakers on pain management have been portraying pain as a clinical problem to be treated and opioids as safe and effective for this purpose. During this time, pharmaceutical industry efforts to mislead prescribers and to market directly to consumers have encouraged the liberal use of artificial analgesia with opioid medications. Biomedical myopia and regulatory incompetence, fueled by both good intentions and greed, have ignored the benefits of the normal pain response and the risks of opioids, and this has contributed to a massive deviation of the established standards of medical practice in the United States. The result, unfortunately, has been a dramatic increase in prescription opioid sales, with a consistent linear relationship to the morbidity and mortality associated with these products. The use of opioid medications to suppress normal pain sensation gives the illusion of improved tissue health, while in fact the proper modulation of movement and muscle forces has been disrupted. Peak opioid levels allow prolonged physical inactivity, as well as overactivity and overuse. This can lead to inflammation and damaged tissues. And pain signals from these damaged tissues are able to break through as opioid levels fall. This creates the breakthrough pain, which is compounded by opioid tolerance and withdrawal hyperalgesia, or increased sensitivity to pain. And all of this increases suffering and disability. Opioids are also highly addictive and have numerous other severe adverse effects on physical and mental health, leading to impaired functioning, emotional and physical distress, and devastating psychosocial problems. The long list of social and financial costs of these opioid-related problems have ripped families apart and devastated communities across our country. Many tens of thousands have died from unintentional overdoses. There are indications that our national public health emergency could soon become a worldwide health crisis. Now, there is hope. To put an end to this raging epidemic, doctors, patients, and policymakers can fully embrace clinically sustainable pain management. This will be based on understanding that healthy tissues require an intact physiologic pain response, including the continuous and uninterrupted ability to feel pain throughout our body, as well as pain that can guide our movements, whose frequency, duration and intensity are modulated in order to minimize pain. This physiologic pain response protects us from the ever-present threat of weight-bearing ischemia and from the frequent threat of excessive mechanical forces from our own muscles, as well as from many other less common but sometimes more severe tissue insults. Now, this transformative paradigm in understanding pain suggests that the proper basis for effective and sustainable pain relief lies in maximizing tissue health and healing. Clinical advances in mainstream pain management for most patients will be those that support a properly functioning physiologic pain response. Examples include educating patients about the benefits of pain, helping them improve their perception of pain through greater mindfulness of their body and their movements, helping them avoid inactivity and overactivity, facilitating frequent and gentle movements throughout the day, getting adequate sleep, maintaining a healthy body weight, and the use of non-steroidal, anti-inflammatory, or antidepressant medications if necessary, and the avoidance of artificial analgesia whenever possible. Now, inexplicably, this vital understanding of how our bodies work in regards to managing pain has been missing from the mainstream sources of information about pain and pain management. We must shift the biomedical paradigm toward letting pain be our guide. And if you're interested in learning more about this perspective, please check out the other videos that follow, as well as the links to my blog, and that includes many web links to primary web resources. Dare to be true, dare to be mindful. Aloha.